Hi, my name is Dr. Shane Smith, chiropractor at Luxiam Chiropractic here in South Reno. I want to share with you how we help eliminate low back pain in our office, and it starts with a thorough consultation and examination. We go through a full biostructural examination to get to the root cause of your problem, and I want to share with you 3 at-home tests you can utilize to determine what's the cause of your low back pain. So the first one we're going to do is going to be showing a forward bend. So with a forward bend, what you're going to do, you're going to have your hands directly out to the side of you, and you're going to bend forward to reach to touch your toes. As you bend forward and then coming back up, you should feel a normal deep stretch through the back of your legs to the hamstrings. If this elicits back pain, this can indicate an underlying strain or sprain in the deep muscles of your spine, or even a facet joint irritation. The next test we're going to show you is a quadrant test. So what we're going to do is we're going to challenge the joints of your spine. You're going to first extend backwards and then side bend to the side of where you have pain, and then rotate your spine. You're going to perform this on both sides. If you feel just a nice deep stretch, it's a negative finding. There's no underlying issue here. But if this elicits or recreates your low back pain, this could indicate a facet joint irritation. These are the individual joints within your spine that could be irritated or inflamed, and this is a diagnostic tool to get to the root cause so we know how to best correct it. The final test I'm going to show you is a slump test. So you're going to want to be seated for this. What you're going to do in the seated position, you're going to first tuck your chin and then slouch your back. Next, you're going to flex your foot so your toes face upward towards your head, and then extend your foot forward, extending through your knee. You should feel a stretch right there behind your knee. That's normal. The test is going to give us a positive or negative finding when with your head you look up toward the ceiling. As you look up, if you notice at least a 50% reduction in that pain or discomfort, that is a positive finding that there may be a nerve root irritation or fixation within your spine, resulting whether from the spinal cord through the pelvis or even a strain all the way down to the foot. Now these are great tools, and there's many diagnostic tools to get to the root cause of the problem that we perform in our office. We do that full biostructural exam, both in range of motion, posture, functional movement screening, as well as x-ray, to really understand how to best help and correct the issue. Using these tools at home can give you indicators whether or not a deeper analysis and assessment is appropriate to help relieve the low back pain you may be experiencing.